So I just want to say first off, thanks for tuning in and watching my virtual lecture here on post-traumatic growth. Um, I would usually do this lecture to a whole group of yourselves, nursing students, first years coming into the main lecture hall. Usually about 200 or 300 of you is there. I would usually follow up on a lecture by one of my colleagues who would explain the effects of trauma on individuals affected by the troubles, the conflict here in Northern Ireland and across the world. I would then come in and follow up with my experiences as somebody who was a victim of conflict and somebody who's experienced then post-traumatic growth. And I would usually come in with this this notion of how people recover and then thrive after experiencing a traumatic event. Now, I'll try and do the similar thing today. Obviously, there won't be a good question and answer session afterwards, but I'll try and just run through what I would usually say to yourselves, and hopefully you get something from it. My name's Paul Gallagher. I first sort of really experienced the conflict when I was born here in 1972. Lived through most of the troubles, relatively got off scot free compared to a lot of other people who were killed and injured. But the troubles came to my door quite literally in January of 1994 when there was a knock on the door and four men came into my home, held myself and my family hostage for about an hour. They were here to assassinate my next door neighbours. They didn't turn up, so instead of leaving without taking somebody, they shot me instead. I was hit 6 times through my right side. Bullets went into my body, other bullets went out the left side. Was left with severe injuries, injury to my arm. I lost my spleen. I lost part of my left lung. My femur was hit and shattered the femur. Also severed the femoral artery, which you'll all know of, is a very serious artery to hit. So nearly bled to death here in this room 20 odd years ago. My spine was also hit as well with one of the bullets, and it left me paralysed from the waist down, T10. Now you can imagine severe sort of pandemonium in the home here. My parents were here, my younger brother and sister were here. I was 21 at the time, and I basically nearly died on the settee right behind me here in this room. But thanks to being close enough to the hospital and the ambulance being phoned, they were here within about 10 minutes. Now, up until that time, you would have had my brother and father trying to keep me alive, trying to plug the wounds with towels, and Damien would have been slapping me around the head and squeezing my arm and trying to keep me awake. So a pretty traumatic event for not just me feeling the physical effects, but for them as well, having to sit and watch and try to keep me from going in and out of consciousness before the ambulance arrived. And that was then obviously my first sort of meeting then with the National Health Service that on this occasion. Many other occasions after that, but none really before that. The odd visit to the doctor. I was healthy enough 21-year-old just getting on with life. But life was changed really in those instances when the gunshots went off. The life I had before that would have then changed into something completely different after that. And I want to explain to you then about that journey and how long that's taken me and what that journey has sort of meant to me and to people around me, and how I've been able to use that for something that's it's more positive considering the traumatic events and horrible events at that particular time. But as I say, the ambulance men arrived in. As I was still going in and out of consciousness, they had got me onto the stretcher and into the ambulance, and were bringing me down to the Royal Victoria Hospital then, where the surgeons then were awaiting me. I remember the whole sort of trip down, in the back of the ambulance, screaming and singing some sort of mad Native American type chant or something. Hoya, 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 hoya. It was very strange having that memory, and then being brought in through the hospital, looking up at the strip lights on the ceiling that you would see in the movies, and being brought into the operating theatre, and the surgeon telling one of the nurses to shut this man up singing. So that was that. Conked out, put under for the operation, and woke up a couple of days later, with a ventilator down my throat to try and keep me breathing, and not knowing what had happened or why it had happened or anything like that. Just in shock, really. But I'll always remember first waking up, and it's something that will always stick with me, and something maybe yourselves as nurses might be able to hold on to yourselves going into the future, into your careers, is waking up, and the first person I seen then was this nurse in intensive care unit, and to me, he was just holding my hand. He was like an angel. Just as I remember, just the kindness of just holding my hand and just telling me things were going to be all right, and I was alive, and just not knowing where I was, and full of morphine and all sorts of things, to keep me sedated. But that was the first thing I remember, and it always sort of sticks with me, even 26 years ago. And that's something I think is very important for yourselves as nurses to keep in mind, that for many people, they'll wake up and you're the first person to see, and the way you react to them, and the way you show your kindness and your empathy and compassion really sticks with somebody. And for me, that was, looking back, one of the building blocks of my journey to recovery. And for a lot of that is around how people treat you when you're recovering from a trauma. It's around how you get this support from people around you. So for me, the first basis of support then was, okay, the paramedics, but the nurse just being there with me was that first person that sort of gave me that kindness, showed me that kindness and dignity, yeah. So moving on then, from getting in the intensive care, waking it up, obviously then family were able to come in, but it was hard to communicate because I had this ventilation tube down my throat, and that was there for about 10 days, and it was hard to communicate. It was hard to convey thoughts and feelings about what was happening. A few days into this, maybe about a week later, the surgeons come around and said to me, look, you're paralysed, and you'll not be able to walk again. You've lost the use of your legs, and you'll be in a wheelchair, basically. And for me, I think that was really hard to take, especially not being able to say anything about it. I was only communicating through a whiteboard, or an alphabet board, or marking out letters or writing things down was the only way I could communicate with people. So I think when I was told that, I cried for a day or so, do you know what I mean? But I think the kindness of the different nurses then who were coming in around me, the physios who were coming in trying to clear my chest so I could get the tube out, and all that sort of support really stuck with me. And they were saying, look, this isn't the end of the world, do you know what I mean? You're alive, you'll recover, and you'll get there. You'll get back out, you'll get home. and you'll be able to live a life. And those sort of things really stuck with me, and sort of gave me that bit of hope and support, um, as well as family then coming in. And then, say, getting the tube out gave me that extra sort of release then where I could start to talk about what was happening to try and make sense and get answers. Moved up then onto the wards to recuperate and to get the operations done on my femur and stuff and things like that, and to put a pin in. Moving then over to Musgrave Park Hospital about a month later into the rehab ward, spinal unit, to basically get used to life in a wheelchair, to do some physio to get the strength built up again, and all those things that happen over there. And again, this was a different sort of group of nurses with a different attitude and a different way of seeing things. But again, compassion, dignity, and kindness came through there too, and I'll always remember them for that. Then it was a matter of getting home, and that happened maybe about 6 months later. Friends and stuff were able to come in and visit Musgrave, and I managed to escape to the King's Head a few times and things like that. So it was just trying to get back to a sort of life of normality, just an ordinary life again. But it was difficult. It was difficult to come back to the home that really wasn't equipped for what had happened to me. I had to come in. There was a ramp put up from the front door. I had to come in and live in the front sitting room, and that was turned into my bedroom because I wasn't able to get upstairs. There was district nurses then would have come out. They would have been my cleaning the wounds and different things. My family would have done that. After shortly out of hospital, I was brought away to Tenerife with a group of friends, and for 2 weeks, and I was still covered in holes, and they were my doctors and carers and things like that, helped me in the bathroom and all sorts of things, cleaning the wounds as well every few days. So it was a whole social support around me, family support, and that's very important when it comes to building the blocks and planting the seeds of post-traumatic growth, that you have that support around you, that people take you seriously and listen to you and things like that. And it's very important, especially in the early days, that those sort of social structures and social supports are put into place. Now again then, this sort of journey of growth that I'll go on to talk about and explain some of the factors involved in it doesn't just happen overnight. Do you know what I mean? It's a long journey. But for me, a lot of those support structures put in place the the basis that I could build this growth on. And that's very important. Later on, like after a few years, I wasn't doing much. You know, I was recovering. I was living in a lot of severe sort of chronic pain, eating a lot of tablets to try and deal with that. That just were not giving me any quality of life. A lot of painkillers and stuff, and I had to go off them after a while because they just weren't working and giving me the life that I wanted. Found myself sort of struggling over those years as well, not really having any sort of focus of where to go. I wasn't able to go back to work, I just wasn't fit. Just got depressed and things like that. But I ended up starting to move into work with other victims of the conflict, of the troubles, and that was probably about 10 years ago, back in 2010, about 15 years after the injury, because I hadn't really been involved in things like that. But that brought me towards WAVE and another victims group, and working with people who were in a sort of similar situation to myself, and seeing that people like myself struggle with the same sort of things over the years. Like I was injured in 1994. There's people in the group who had been injured in the early 70s, but living with this stuff for years, and you're just able to see how they were able to cope with things. And that brought us into contact with the WAVE sort of injured group as well. Now, the WAVE injured group at the time were starting out on a campaign to try and bring support for people who were injured during the Troubles, who had sort of felt maybe that they had been forgotten about. with all the other things that were going on about the peace process and things like that. Injured people felt as though they'd been left behind and all that. And this group then came together saying this campaign got involved in storytelling. They'd written a book about their stories. And that's important when it comes to building on from trauma as well, that your story and your experiences are taken seriously and that you're listened to by active listeners. I think that's important for yourselves as nurses too, to try and be good listeners and to try to actively listen to what people are saying to you. I know a lot of the times you won't have much time to sit with people. Wards and whatever else are very busy, or for district nurses, you're in, you're out, and things like that. But to try to take the people seriously who you're working for and you're working with is important, and we'll come to it later. But that's another part of post traumatic growth, is having your story listened to. It's also about then building a new narrative about what happened to you, about trying to make sense of something that really doesn't make any sense. Do you know what I mean? It was so horrible, and there's nothing really you can take out of it, but to try to take something out of it. For me then it was that, like, I had survived this thing, I'd recovered. Okay, I was living in pain and everything else that comes with this sort of trauma and stuff, but I was still alive. I was still able to talk about it. Still able to maybe take some use out of it. And for me, the use then came from being involved with WAVE. WAVE had set up a system within that where their members would become citizen educators, and that's what this talk was brought to today. WAVE went out to social workers, to nursing students, to medical students, counselling students across the board, to try and give them this sort of trauma focus, informed sort of focus around trauma, to take into their careers, to understand how it affects people and how you can actually help them to recover and hopefully then to thrive and grow after the trauma. So that's why we're getting this opportunity to speak to yourselves and to come in for this past, say, 10 years or so, teaching yourselves different ones over the years, and going with some of the feedback I have from some of the nurses who I would bump into in my travels, who'd be out to my house as district nurses. They take a lot from these lectures and from the tutorials that hopefully as I'll get to see and get to meet other members of WAVE during the year in smaller groups and be able to ask them questions face to face instead of taking case studies from books or whatever else. So hopefully this will help you as well. To get back to the other sort of building blocks of trauma and how you can actually help in that. So it's around listening. It's around being that expert listener, about being that person that takes your patient or whatever seriously, and lets them give meaning to their story, lets it be of some use to society and to their family and to themselves, to help them understand that sometimes bad things happen to good people, and it's the world for a lot of people over the years many people believe it's a benevolent world and everyone tries to do good, but it doesn't always happen that way. Sometimes when trauma kicks in, those sorts of thoughts and feelings about the world being a good place get shattered. It's about trying to rebuild those blocks that have been shattered, those sort of thoughts and feelings about the world, and then about your own safety and your own security that are shattered by that. So being there at the start and through and helping people can help put that back together. Now that's recovery, being able to sort of get back to where you are before. But growth is something different. Growth sort of transcends the recovery process and takes you to another place. And these sort of things that come out through the theory around post-traumatic growth is that people have a greater sort of appreciation for life. They also have a more enriched human relationships with others that maybe they didn't have before. There's a sense there that there's new possibilities in their lives, and people can sort of take advantage of those new possibilities and move on from those. Maybe there's a sense of a greater spirituality within people, whether that's religious or some other feelings of spirituality. And yeah, there's a sense there that their story means something, and their narrative means something. And there's a sense that maybe you're a new person and you create a new identity from this. And that's something that I would echo with a lot of those things that have those symptoms of post traumatic growth have happened to me over the years. When I look at the day that I was shot and injured, that was the day that I said that my life before sort of ended, a new life begun. It was nearly not in the religious sense, but born again in some way. And you had to, you know what I mean. You had to learn how to walk again, the wheelchair and stuff. You learn how to um, go through the terrible twos and the tantrums and the anger that came afterwards and the trauma in those years. The moody teenager in those years, and maybe into your late teens and early 20s, then and sort of growing up and starting to do something with your life. And that for me then has been the journey of growth for me, and I'm still on that journey, and it goes back and forward depending on how things happen. But for the most part, it's been around being able to have the opportunity to give something to people like yourselves, and for also then to get something back from you by usually being in a big auditorium, a big lecture hall of 300 of people sitting listening to my story, and then interacting with questions and the back and forth, which I miss and will miss from this today. But hopefully, maybe we get a chance later in the year, or maybe next semester or next year, to do this again and to get in there and have the smaller tutorials with yourselves in your groups. Because for us, we get something from it, but we also feel as though we're giving something to you. So good luck on your travels, and be careful out there as well, because like the way we used to come in and talk about our troubles and the conflict that had been going on from the early 1970s to right up into the mid 90s, for a lot of yourselves, that's past history. Do you know what I mean? That's something that happened 20 odd years ago. A lot of you students are young people. And so we were always trying to give you a sense of how such a traumatic thing affected us back in the day. But for yourselves, this coronavirus thing is your troubles. And okay, there was 3,500 people or so were killed over 30 years. At the moment, there's so many thousands are going to die right now because of coronavirus, and into the future too. And you people are going to be on the front line for that. And for you yourselves, that is your troubles, and that is going to be, I think, even harder for yourselves to recover from. So I'm worried for you, but I'm also hopeful as well that the solidarity and that you receive, not just from your co-workers and nurses and frontline workers, but from us as a society as well, and how we'll be able to listen to your stories going into the future, and how hopefully that helps yourselves to recover from this and they actually thrive as well. And that we listen to your stories, you begin to grow from your own traumas that you will see in the next few years and your colleagues will talk about, and to really take it seriously about the severe way the trauma affects the mind, and how your sense of security will be totally shattered by the things that you may see over the next few years. But again, to try and take some meaning out of it, that maybe there's good things that happen from out of this, even in the dark days of when you're going to need to be there for people who are taking their last breath and don't have their family around them. And it's usually them and their family are there with them. Now you're going to have to be that person. And I just hope you can get through it, maybe as well as I get through my trauma. So thanks for listening. Best of luck into the future.